Hello, my name is Dr. Bob DeMaria, and I'd like to welcome you once again to another episode of Doctor to Doctor. As you can see, I happen to be the drugless doctor, and today we're going to talk about something that's near and dear to every one of you. When you wake up in the morning and you brush your teeth and you shave and you wash your face, you look at your skin. Today I want to talk to you about skin health, getting optimal skin without having to take any medications. Wouldn't that be wonderful? One of the most important things to do is you are going to need to make some changes if you're not totally happy with the way your skin looks. This happens to be a glass of water with lemon and lime in it. Probably one area, the simplest tool that you could do and add to your everyday routine is water. Drinking water purifies the system. I know it sounds really simple, but cells are like little factories in your body, and they have waste products. So when you consume food and your cells use those to make energy, there's byproducts of metabolism. This happens to be an oil filter. Now, what I'm going to share with you right now is probably one of the most significant little nuggets you're ever going to hear. This oil filter is analogous to the liver in your body. Anytime someone comes into my office and they have skin issues, I always want to ask them a question. So you're ready for the question? Do radishes cause distress? I say, Dr. Bob, what are you talking about? Well, part of my training is I have a Doctor of Natural Health degree. And in my coursework, I took classes on herbal medicine. See, radishes are bitter herbs, and one time our church was having a Passover and they used radishes as the bitter herb. I think the Lord was teaching me something many, many years ago. I've never forgot that. So when radishes cause digestive distress, it's not the radish. The radish is doing its job. It's promoting digestion. So if you have your hand in the cookie jar, and I'm not here to slap anybody's hand, but sugar compromises liver function because your liver has to work really, really hard. There's something that I like to talk about called Dr. Bob's ABCs. It's a half of a red apple every day. See, red apples promote digestion. You could control and manage your cholesterol and lower it up to 13% by eating at least one half of a red apple every day. Not that green apples are not good, but green apples tend to stagnate digestion. Red apples promote digestion. A part of my training is an Indian or Ayurvedic medicine. It's all about digestion. Now, I know what you're going to learn next is also very significant. This happens to be a visual for a beet. It's actually a plum, but for the case of this presentation today, this is a beet. Beets are important for liver function. You can lower your cholesterol up to 40% by eating 15 grams of beet fiber. About a third cup of beets is what I really like to promote on a regular basis. I personally cook for my family 10 beets per week. I have beets in my salad every day. This is an important liver food. Now, another item that is really significant are carrots. And I know that you've heard about carrots. Carrots have items in them, mineral precursors for vitamin A. Now, I know somebody out there right now, there are probably millions of you watching me right now that have little floaters in front of your eyes. They're called vitreous floaters. Now listen, if you start eating one medium carrot every day, and if your little floaters are caused by a lack of vitamin A and or liver compromise, I'm going to give you some good news. In 6 months, you'll notice that those little vitreous floaters will start to go away if, in fact, they're caused by compromised liver function. The liver is the storehouse for vitamins A, D, E, and K. I eat one medium carrot every day. I eat a half a red apple every day, third cup of beets. So it's kind of like the old story, you rob Peter to pay Paul. Well, your liver, which is the storehouse for vitamins A, D, and K, will take the A from your eyes for your skin. Here's something else I want you to understand. Fire. Fire is inflammation. Sugar causes inflammation. There's a process called glycation. When you're finished watching me today, I'd like you to do a search on this, glycation. Glycation. Glycation is when sugar and protein come together and you eat them, causes inflammation in your body, inflammation on your face, maybe something like acne or rosacea. Listen, always talk to your primary health care provider, listen to their directions, but I want you to make some changes if you want your skin to clear up. I also know many of you have large pores on your face. Large pores on your face are a body signal to me that you have a deficiency of zinc. The same with white spots on your nails. What depletes the body of zinc, you might be thinking? Grains. Wheat and soy deplete the body of zinc. Zinc's important for memory. Zinc's important for blood sugar stress. And having not enough zinc for a man can cause heel pain. We talk about body signals in this book, Dr. Bob's Drugless Guide to Balancing Female Hormones. See, my passion is to make a difference in your life. So I don't want you just to be entertained by me. I want you to take action steps. Minimize gluten grains, rye, wheat, oat, and barley. They're not bad foods, but many of you eat too much of that all the time. Try some quinoa. Try brown rice. Go gluten-free. So I just need you to be aware of that. Now, water, once again, is important because water purifies liver function. I'm going to give a little solve for a real challenge that so many people have. Young ladies that have acne around the menstrual cycle, it's usually liver distress. Young men that have acne because they're consuming dairy, cut back on your dairy. Oh, but Dr. Bob, where do I get my calcium from? Well, when was the last time you saw a cow eating cottage cheese, milk, or ice cream? They don't. They eat hay grass and alfalfa. Coconut milk, great alternative to dairy products. So just for 3 months, minimize your grains, minimize dairy, eat kale, eat green food, that's a great source of calcium, drink your water, eat Dr. Bob's ABCs, a half an apple every day, 1/3 cup of beet fiber, and 1 medium carrot. My name is Dr. Bob DeMaria. I am the Drugless Doctor, and I want to thank you once again for joining us each and every week on Doctor the Doctor. We are here to make a difference for you. You need to put your foot on, or hands on the plow, foot in the Red Sea to make a difference. Take a few of these tips, apply them. I promise you, you'll be glad you did. Hello, my name is Dr. Bob DeMaria, and I'd like to welcome you once again to another episode of Doctor to Doctor. And I happen to be a drugless doctor, and what we're going to talk about today is increasing your energy 300%. See, I know that so many of you woke up tired this morning, you went to bed tired, you woke up tired, and you don't know what to do. Well, for those of you who are not mechanically inclined, this happens to be a piston that's in an engine. There's usually anywhere from 4 to 8 of these in any engine. They go up and down, and they cause a shaft to move. That shaft allows your tires, either your front or your back tires, to allow the car to go forward. Well, your body needs fuel. This is a gas can. This is a 5-gallon gas can. This is fuel to your engine, just as fuel is to your body. So let me give you a couple insights. If you woke up this morning and you had cold hands and cold feet, chances are your thyroid gland is not functioning at 100%. Your thyroid gland is the gas pedal in your body. That means when you push that baby down, you are going to go. The adrenal gland is your fuel pump. Your adrenal gland is a pair of glands located on top of your kidneys. So when you eat food, your body has to go through steps. The pancreas secretes enzymes, the liver secretes bile via the gallbladder, getting everything ready to go. If you continue to eat lots of sugar, I know that those of you watching me anywhere in the world right now consume about 28 teaspoons of sugar every day. Sugar tends to leach minerals from your body. So you could have a spike of fuel and then you drop. So during the daytime, if you're consistently eating sugar, you can have highs and lows, but over time, you're going to be consistently low. So one of the very first steps to increase your energy, minimize grains, minimize sugar, because oftentimes they put sugar in grains, so you're eating pastries. So I don't want you to start your day with a pastry, because your blood sugar is going to go up and then it's going to go towards the bottom. So the gas pedal is your thyroid gland. You may want to have that tested. Cold hands and cold feet are common body signals. So if you're sitting on the couch right now and you have cold hands and cold feet, wide spaced teeth, thinning hair, you may ask your healthcare provider to complete a test on you called TSH, Tom, Sam, Harry, T3, and T4. Those are standard blood tests for your thyroid function. If those tests, especially the T4 and T3, are less than the midline, you may want to have some conversation with him on what to do. I'd recommend, male or female, this is one of the books that the Lord has blessed me to write. It's Dr. Bob's Drugless Guide to Balancing Female Hormones. In this book, we talk about thyroid function. So if you woke up tired, cold hands, cold feet, it may be a thyroid issue. Now, we talked about the adrenal glands. The adrenal glands happen to be your fuel pump. Remember, thyroid's the gas pedal. Well, if you wear sunglasses, when somebody comes into my office and they have sunglasses on their head, sunglasses in their purse, or sunglasses in their pocket, or sunglasses on their face, that's a body signal to me that their fuel pump is tired. Because see, one of the job descriptions of the adrenal glands is it causes your pupils to constrict. But if your adrenal glands are exhausted, bright light's going to bother your eyes because your pupils will stay dilated. You say, Dr. Bob, so then what are you telling me? Here are some body signals for individuals who have subpar adrenal gland function. Bright light bothers their eyes. They get dizzy from a sit to a stand position because their blood pressure drops. Crave salt, potato chips, pickles, and olives. So your adrenal glands are starving for minerals. In the human body, what I'm holding in my hand right now is a spark plug. The spark plugs in the body are minerals. Your adrenal gland, once again, the fuel pump, needs minerals to fire to get the piston to go. You can say, well, what are you saying, Dr. Bob? I don't understand engines. See, this is a piston which needs fuel to fire. The fire comes from a spark plug, which are minerals. Your adrenal gland needs minerals. So if you wear sunglasses, that's a body signal to me that your adrenal glands are tired, and chances are you're eating too much sugar, which is taking minerals out of your body. So you want to have a good source of minerals. Maybe something like an unrefined salt. I would stay away from franchise restaurants that have a lot of sodium in there. You want minerals. A great source of minerals is unrefined salt. Any kind of green leafy vegetable, especially one that's organic, will go a long way to helping you. So if you woke up this morning and you're tired, think about what you've been eating the last 3 or 4 days. I mean, I really want you to analyze this because I know many of you crave sugar. If you crave sugar, we encourage a mineral called chromium. Chromium helps take away the craving for sugar. See, we do mineral tissue analysis to our patients. And one of the reasons that we do that, excuse me, is to assess the minerals in their body. So if you have your healthcare provider perform a mineral tissue analysis on you and your chromium is low, yes, you could supplement with chromium, but at the same time, you really want to stay away from sugar. So what do you eat? I would eat non-starchy vegetables like kale, broccoli, and cabbage. Lean muscle tissue, almond butter. We don't promote peanut butter because it tends to create sinus challenges, and we don't really promote dairy products because they can promote sinus challenges. We promote coconut milk. So you want protein. There are great sources of vegetable proteins. I eat vegetables every day. I am not a vegetarian. If you are a vegetarian, that's fine. But you want to avoid grains that have gluten in them because it compromises the adrenal gland function. This is very serious. If you don't want to do, if you do not know exactly a plan, Dr. Bob's Drugless Guide to Balancing Female Hormones may be an answer for you. My name is Dr. Bob DeMaria. I am the Drugless Doctor. I'm here to make a difference in your life. We really appreciate you watching us on Doctor to Doctor every week because we're here to give you ideas and information. You know, Jesus came to set the captives free. I'm here to set you free, but you have to take the first step. You know, Moses had to put his foot into the Red Sea. Joshua had to put his foot into the Jordan River. Thank you for joining me today. Make a few of these changes. I promise you, you'll be glad you did.